Well, hello everyone. My name is Todd Gill. I'm with the Latin American Chamber of Commerce. I've been with the Chamber going on my 7th year. And this year I actually had the opportunity to join the Executive Committee as the Secretary for the Latin American Chamber of Commerce of Charlotte. And I thank you and I welcome you to the LACC Mid-Year Conference 2020. And today I have with me Gustavo Bernal. Gustavo's with North Carolina Blue Shield, and I just want to welcome him today as my guest, and we're going to have a conversation regarding his role at North Carolina Blue Shield, along with how he and his team are working through the current 2020 year. So Gustavo, welcome to you, and thank you so much for joining me today in this discussion.
Todd, thank you for having me, and it's my pleasure to be part of this conference.
Well, just to kind of kick the can and open it up a little bit, tell me how you and, North Carolina Blue Shield have been coping with this period of time. Tell us about what you currently do at North Carolina Blue Shield and how you've made it through the first half of 2020 so far.
So, Todd, let me start. I'm original from Bogota, Colombia. I have been in the country for a little over 17 years and with 25 years of experience in marketing and communications with different brands across the Latin American, the Caribbean, and USA market as well. I have been in this role with Blue Cross Blue Shield of North Carolina, brand sponsorship and activation for a little over 2 years. I manage the relationship with Charlotte Hornets, the Greensboro Swans, Carolina Hurricanes, and the newest Charlotte MLS team. Also, on top of that, I manage all the multicultural initiatives that we have in the market. And one of my partners is the Latin American Chamber of Commerce that has been a pleasure to work with them. In previous roles, I worked for the Diversity and Inclusion Market Program for a little over 4 years. I served in different organizations across the state, and I enjoy bicycles, and I enjoy practice yoga, and of course, traveling. In terms of what we have been doing with these unprecedented times that we are living, well, the first thing that we did is realize that we have to accept the tough change that we are facing everybody here in our country and actually worldwide. And we need to understand how we are going to work on this new environment, not only work from home like we are doing today, but also how we can connect with our members or our clients, in our case, our members. For me, personally, means that I have to change all the way that I approach to engage our consumers. As I mentioned before, my role is to manage the relationship with teams. So we go with my Blue Cross team to engage people to basketball games, hockey games, festivals, different events that organizations put across the state. So we have to rethink that. And I have been working with our partners to see how we can connect with our community and be more involved on what they need and what the community is looking for. And one of those is with the Latin American Chamber of Commerce.
Well, that's a lot of great information. I appreciate you sharing that. But what I heard you say is you may have tickets to some of the sporting events in the near future. Do you have those contacts that we can kind of talk about offline?
Yes, of course, Todd. I can help you with that. Just let me know and we'll try to do it the best.
Well, it sounds like you have a lot on your plate. Can you kind of expand a bit on how your team has managed over the last several months to work from home? Do you still have quite a few people in the office, or has everyone been working from home like I have with State Farm? We're all working from home now.
Todd, it's the company is very conscious on the situation, and one of our main thing is to keep our employees healthy. So at the beginning of the month of March, on most exactly on March 12th, the leaders sent 50% of the employees to work from home, and the virus start to be more aggressive than everybody expect. So on March the 19th, we work 98% of the employees are working from home, and still today we don't have clear direction on when we are going to go back to the campus, but the company is working on that and take all the uh, security and cleaning and everything so they can offer a good place to work for our employees, because at the end, if our employees know are healthy and safe, we cannot support our members. So that's priority for our company.
Well, considering what you just said, has Blue Cross Blue Shield of North Carolina had to in any way redefine what success looks like during this current time?
Yeah, for us is we have been focused on what means success, and we are transforming the healthcare system. Even before this pandemic start to spread across the state. And we are committed to make the healthcare better, simpler, and more affordable. We learned from this that the changes can present at any time, and we cannot wait for the change arrive. We need to be proactive and change the things as soon as we can. And this pandemic is one of the cases. For example, Blue Cross developed a plan, a program that is value-based care, and it's called Blue Premier. It's a program that our CEO and the team put together to work with the hospitals and providers to make the healthcare better, simpler, and more affordable for our members and communities. Second, we currently are working on telehealth policy, policy that is going to be implemented on 2021 to better support our members that are using that tool to connect with the doctors. It has been a tool that a lot of our providers and our members are using to connect during this pandemic. And last but not least, we are making behavioral health care more affordable and more accessible to all North Carolinians and members.
Well, you know, cost just as an individual when it relates to healthcare is so important to us all, because at the end of the day, we all have to utilize healthcare services at some point. So I find it very exciting that more of us will have access through technology to the healthcare that we need. Do you have any rough estimate of how many more people have started to utilize those new services, or what those expectations look like for 2021?
Todd, I don't have those numbers, but I can share that later. I go back to my team and ask for those numbers, but I don't have those numbers with me. What I can tell you is, in the beginning of the pandemic, we switched because we, based on HIPAA, we need to ask the doctors and providers to use a specific tool to do the telehealth or telemedicine. We change based on the rules, and we allow the doctors and the members use their iPhones or their phones to connect with the doctors, and we consider that as a telehealth. So probably our numbers are going to not be exactly, because a lot of people don't download that application. A lot of providers were not ready to implement it. So probably the numbers will be a little off, but we know that a lot of people is using, because doctors included are pushing the people to do it, that for the safety of the staff of the provider, but also for the safety of the person that is going to attend to those facilities.
Yeah, I think you hit the nail on the head. Everyone wants to have a feeling of safety. When you think back to, it sounds like about 50% of the office is working from the location and 50% are working from home. Have you had any significant or relevant concerns for those folks who are going into the office on a daily basis? Or do you have certain procedures in place, maybe scanning for temperature and that kind of thing?
Todd, let me clarify a little bit. We in March 12 was 50%, and a week later we switched to 90%. Today we are 98% working from home. We don't know if that is going to change in the next couple months, but right now it's 98%. And if you have to go to the office, you have to follow a protocol and guidelines that the company put together. All the campus is closed. The only access is to the main lobbies, but you have to be request access to the building, and the senior VPs authorize your kind of access to whatever you need. But no, we don't have any cases in what we take the temperature for that 2% that is working from home. I think that, working at our campus. And yeah, I think they have all the protocols on place and they are following, because we have no reporting anybody with the COVID-19 or any situations that we need to take care.
Well, Gustavo, when you and your team start considering the third quarter into the fourth quarter for 2020 and beyond, what words of wisdom can you tell us as you start moving your team forward, and what type of projects maybe, or what type of expectations do you have as we wrap up 2020?
Todd, it's really hard because we all kind of learn different things from this pandemic. It changed everything, professional and personally, for everybody, everybody around the world. And Blue Cross is not the difference. For us, it has been very challenging moment, and my team, which is in charge of all the sponsorships and activations across the state, has been a challenging season for us. In my case, we need to switch from be sales and more oriented to supply things for the community. So for example, yesterday we did a meal delivery program with the hurricanes to the UNC Rex Hospital in Raleigh, and we are going to provide meals for that people for the next couple of weeks for the health workers at the UNC. Things like that, we have been working with our partners and see how we can support the healthcare workers, the essentials, but also the community. The company, our CEO, Tunde Sutunde, has been committed to support the governor on the 3W campaign. So we are looking how we can implement that message on all our sponsorship. So we have been working on that, and hopefully we will have a very successful season after all these challenging times.
Well, I'm sure that those first line healthcare workers appreciate what you folks are doing for them. They certainly are heroes right now and continue to be probably into 2021. And it's so important for organizations such as yours and mine at State Farm to recognize those who are really helping advance and move the ball forward as we kind of get our footing in the new normal, if you will. But I really want to thank you, Gustavo, let you know that we appreciate your support and the support of North Carolina Blue Cross Blue Shield with the Latin American Chamber of Commerce Charlotte, and look forward to continuing to work with you well into 2021 and the future and beyond. So thank you so much for your time.
Thank you, Todd, and it's my pleasure to be partnered with you and represent Blue Cross Blue Shield of North Carolina here at this time. Thank you.
Thank you.